welcome to the Tuesday or this week's edition of the Yamhill Leadership Roundtable. We have Abhishek Sohn from SEDCOR. We have Casey Kula from Yamhill County. We've got Takesha Rydro from Sheridan Revitalization Committee and so many other things. But that's the one that she's power on. We have Joya Goodrum from the McMinnville Chamber of Commerce. We have Senator Arnie Roblin from almost all of the coast. Well, okay, a lot of the coast, 7 counties, plus a little bit of us. We have Scott Kubert from McMinnville Economic Development Partnership, and we have Mayor Michael Cape from the city of Amity. Welcome, Mayor. And I just wanted to, before diving into asking Senator Roblin, kind of the state level perspective on coronavirus, I just want to note that we are entering the 2-week freeze statewide. And I've had a lot of people ask me, well, why are counties that aren't as big of a hotspot going in? And the way that it was explained to me is that we were all expecting some level of regional metrics for pauses or changes in activity levels. But last Friday, the hospital capacity in the metro area got so close, the actual to capacity, that the state didn't see a way out except through doing a statewide freeze on many activities. And that was very sobering news to me to hear that. So I hope that everybody will take kind of that into consideration when thinking about what's facing us in the weeks ahead. But with that, Senator Roblin, what would you like to share with people?
So I would say that the governor has kept in touch with most of us in the legislature. And so we got a little heads up that this was going to happen. And then we had a little briefing. Your explanation is, I think, a big part of it. The other part is that, if you look back at the beginning of this pandemic, our governor took some pretty stark measures statewide. She didn't close down all businesses, which some people did. So construction kept going. We kept doing a lot of other kinds of things. But those things where a lot of people had to come in contact with each other and businesses, and actually the stay-at-home order really put a damper. We got control of the virus in the state of Oregon, and really we have not relinquished that. We've had little starts and finishes, and we've found that different gatherings promote the virus, and that the reality is it's throughout the entire state now. So the Oregon State has been going around and checking sewers and looking at the virus loads in different places. And there hasn't been a place where they've checked that they haven't found it in the sewer system. That doesn't mean it's running rampant everywhere, but it is everywhere in the state. And some of our biggest outbreaks have been in Eastern Oregon, which originally thought they wouldn't have anything. And so here we are at a place where the rest of the world, and in particular the United States, is kind of growing out of control. And we've kept our death rate down. We've kept some other things down. We have schools opening. And she decided that she wanted to continue to move forward with schools, that everybody has indicated that's probably as important as anything. And so the things that had to stay open to keep schools going, the daycare stuff and some of the other kinds of things, the personal stuff, she left those open because they haven't shown a real transmission of the virus through any of those. Most of the schools that have had to close or look at their cohorts going on to lockdown have come out from outside, from the family, as opposed to the school itself. And so she, I think, took a cautious look at what we could keep open if we did this, but at the same time, how do we get communities back under control? We've got people going to, every time we've had a holiday, we've had an outbreak. And it's almost always been from social gatherings, bars and restaurants. Those are the places where it's happening. So what she did is, I think, took a cautious step that said, look, let's get a reset. Let's make sure that we don't lose control of this virus in our state, everywhere in the state. So 2 weeks, I know it's kind of tough, especially since people have really been doing a pretty good job in Oregon, and we have some places that don't have it going really rampant yet. But let's just take a break and make sure that everybody understands. And I think she did it in particular because it was going to be over the Thanksgiving holiday, and we knew that was going to create a problem. So let's really think about what you're doing and not expose your family and others and the community to this virus. And so let's take a 2-week pause starting tomorrow, and let's make sure that while we're in that 2-week pause, we watch really carefully at all of the county information. And then in 2 weeks, we'll start reopening those places that seem to have it under control, that have been doing the right things. And talking to county commissioners, some county commissioners have taken it very seriously around the state, others have not. And so we're going to watch and see, how does this 2-week pause really play out? Because in between 8 to 10 days, we will start seeing if we're having outbreaks continue or if we're slowing it down. And if we are slowing it down, then let's reopen again those places that have done it right. We don't think Multnomah County, just too many people, they are in too much contact, and we've got a big homeless population, which we know has a problem as well in passing the virus on. So we know that parts of the state are going to get to reopen in 2 weeks. That's just in time to start thinking about Christmas, and hopefully they'll recognize that if we did the right things during Thanksgiving, we can do the right things there. And limiting the gatherings, the social gatherings, to 2 family units. A lot of people had questions about, well, what if I have a big family? Because you're saying 6, and they said 2 family units includes all the family unit that is staying together now. They can get together with the other family unit that's been together. That may be a lot of people. We have some very large families, but the reality is it's the other group, that single person or that couple that want to have a bunch of friends over Thanksgiving. They're just basically saying, no, either one other couple or group or 6 individuals that you feel comfortable with. That way, contract tracing can happen instantaneously. If somebody gets sick, we can quarantine the right number of people instead of hundreds of people. You can do what you need to do to keep it under control. And I think this cautious attempt at making it work is really, really important. She's lost some of her most key responsible people with this Biden transfer of power. That meant that other people had to step up, and I think wanted to keep on track of all of that. We're working on really doing some housing stuff, and our housing czar, who is really exceptional, is going back to DC to help out as a volunteer. So we have a lot of things happening at the same time, and the best way for all of us as Oregonians to really be the patriotic Americans and Oregonians that we can be is to take seriously and get this thing under control in our state. We don't want to be the next Texas, the next early New York, the next Colorado right now, North Dakota, which is having a big outbreak. We don't want those kinds of things. And the reality is, if Portland is getting close in their hospitals, we don't have that many beds out in the hinterlands. Our hospitals do not have big emergency rooms. So it's really important. And our family just realized again how important hospital space is. My mother-in-law's 2 sisters were at church. They came out on a windy, blustery day up in Washington, went across in a crosswalk and got hit by a postal worker going home. One of those 2 sisters is expected to pass away any time now. The other was life flighted to Seattle and is in a place where she would rather not be, with a broken leg and some other issues. So we understand that having available emergency services is really important for all the other kinds of things that happen in our lives. And if we fill them up with COVID people, it's really difficult to do the other kinds of things. So as we sit here, and as my wife is suffering because she can't be there with her mother to help her go through this thing, who actually was at the same church service and watched it happen. It's been, and now her real thoughts are really with the person that was driving, because she said it was unbelievable. And he did all the right things afterwards. It's just that it was such a wintry night and all of those kinds of things. So I think Oregonians and people in general really have to take stock and how fortunate they are if they haven't been sick yet and don't have a family member that's suffering, and recognize that their responsible actions lead to fewer deaths and more Oregonians surviving this whole thing as we look forward to having some vaccines in the not too distant future. So I guess that's what I would say. I don't see us, we're having legislative days in December. We've got other kinds of things. We've got new leadership in the House, Senate, and both parties. So those things are taking place right now. Not a lot of change took place in those. We've got new members that have to figure out what it's like and to find their way to the bathrooms in the building if they actually get into the building. So there's a lot of things that are happening. My office looks different here at home because I went up this last weekend on a quiet Sunday when no one was in the building and took everything out of my office. So it is not the same place that it was before, and we're ready for a transition of government here in Oregon, which I think will be calm, and hopefully we'll get on with the business of the people. So thank you.
Great. Thank you, Senator. You know, you prompted lots of questions from me, but are there questions from other folks on the roundtable? So my question then is, Senator, the first one, I guess, is, do you think that 2 weeks is enough to see a significant change in either the positivity rate or case counts?
I think 2 weeks, if people really adhere to it and really take it seriously, is kind of a restart. We were all getting very tired of this virus, and we were starting to slip up in a whole lot of different ways when we went and visited other friends, and they didn't seem to be sick. Why would we worry about it? We kind of forget that there's this whole group of people out there that are asymptomatic and can pass the virus on. And I think it was kind of a, let's take a reality check. If everybody does it right and resets their lives in ways that they, when they go out of the house, they put a mask on, they wash their hands, they get more serious about it, then yes, I think it can make the difference, especially in those counties like my own, which, you know, saw 8, 9, now like 10 or 11 cases, which fairly small down in Coos County. But it was building, and it was slowly, insidiously building. And I think it's if we take it seriously, if those kids that come home from college break take it seriously with their families and don't cause the spread, then I think, yes, we can actually start seeing the rates, especially in some of our outer lying areas, go down and get back where we would really like them, under that 5%. You know, New York is putting all sorts of restrictions on, and they have a thriving rate of a little over 2.5%. And they're picking restrictions now because they know what it's like when it gets above 5. So they're keeping it down there for real reasons. And the one that they're really, I can't remember which borough it was, but one of them was just way out of control. It was all the way up to 4.8%. And they were going panicky. So, you know, we have to understand, we have been having rates of 10 and 13%. I mean, you can't survive long term without really knowing that a lot of people are going to get sick and be in the hospital. So I think it can work, but it really depends on the personal responsibility of every Oregonian.
All right, thank you. It looks like Joya has a question for you as well.
Thank you. So thank you, Senator Roblin, for filling us in on, you know, what's happening behind the scenes, because I think some of us don't quite know what's going on. And we hear the governor say, you know, don't gather and, you know, stay away from people. And so I appreciate the backstory on that. Thank you. I've heard some people be very concerned that the governor is going to come back in 2 weeks and tell us all that we're going to have to stay closed until after the first of the year.
I actually am more optimistic that there will be places that will be closed till well after the new year. But there will be a number of places, many places around Oregon, where that will not be true. And it will be done. I think she's kind of settled in on this county by county thing. So I think she will be looking at positivity rates. She'll be looking to see if in that 10 days we started seeing a decrease in some places. So you can start saying, you guys are doing it right. We're going to continue to let you do it right. Please do that, and so on. And I think it's been interesting to watch the science. I got a haircut today, and I went to my barber, and she is very, very particular about, you know, signing in, making sure you filled out all the form work, do all the other kinds of stuff, because she also she's elderly. She doesn't want to get sick. She's lost some customers over that. But at the end of the day, she says, why don't people, and she's an immigrant from Vietnam, and you know, she says, why don't people just understand? I've been looking at some of the other parts of the world. There's some of these places where they have positivity rates of under 1%, because they actually followed all the expectations. I wear a seatbelt every time I go someplace. What's the problem with wearing a mask? So I think, you'll see some places will not get reopened. Other places will, but I think they'll use the science. And I think that's why we left personal care open. It's why we're leaving schools open, as much as they are open, because they've been doing the right thing in a consistent basis, and people aren't getting sick because of those experiences. So that's where I really think it'll be.
Yeah, thank you. One other question, well, actually two. So is the positivity rate, I'm sorry, is the positivity rate that we're seeing because we're doing more testing?
The answer to that is absolutely not.
Okay, good to know.
You know, more testing does not produce positivity rate. More testing actually will lower it if you're doing enough of it, because you get more of the people who don't have the disease being tested because you're randomly testing people. What we've found is that when Oregon State has gone out to city after city with regard to doing the random testing that they do, that their rates are pretty close to the others. They're oftentimes a little lower just because they're testing a whole lot of people. Most of the testing we're doing now is because people think they're sick or they've been exposed to somebody. So we're doing it with a subset of people who are more likely to have the disease or not. So if that's who you're testing, your rates are going to be higher. If you're testing a large portion of your population, you get a better understanding of where the virus is and who's susceptible to it. And I think your rate should go down. So that would be my best guess as a mathematician, statistician. Testing does not change your rate. It's the number of people who have it in your community that causes you the rate change. And that's why the supplementary stuff that Oregon State is doing with the sewer contamination and looking for the virus there is a really good way of finding out whether or not it's really rampant in your community or isolated. But they're finding really small traces just about everywhere they go. So it's there.
Okay. One last question. Do we know what date the opening of the legislature will be in? I know it got moved to January 19th from February 4th or whatever it was. Do we know what day, or is it going to get pushed out further?
So right now we know very little. They haven't made the final decisions. We know that on the 12th of January, the Oregon legislature will convene because that's the constitutional requirement. At that particular time, they have an option to come back in that week and do some stuff just to get ready for the session or not. If they want to not postpone it after February 8th, that's in statute, not in the federal law. Then while they're there at that in January, they need to pass a law that starts it at a different time. And by the time we get there, we should know what those dates would look like. The issue is, if we push it out a little farther, can we think that maybe we'll start having some vaccines and other kind of stuff so we can actually have people in the building? Because one of the big complaints has been we aren't really having the same kind of input from the public in these meetings the way we're doing it, which is very true. But to do that safely is really, really important. And, you know, the doctors came, OHSU, our president likes to invite them to the Capitol and tell us if we're doing it right and we're going to keep ourselves safe. And basically they said, we don't think anybody should come into the Capitol right now with the rates they are at all. But they didn't quite say that. They said, if you continue to do the same things, which is keep your distance, wear your masks, do the kinds of things, stay in your office except when you're coming to the floor to vote, stay away from each other. We think you can do that safely, but anytime you bring more than a few people together, you run a risk. And I asked if we could test, and they said testing in that way is not very helpful. Even if you have the quick test that tells you have it, they do have some false negatives and false positives. So the issue is doing the other kinds of things is more important than getting a test and thinking that you're safe because you took your test. You might have gotten the virus the day before and it hasn't shown up yet. So testing has its limitations. It's best used as a public health product to make sure that you can get a hold of people and quarantine the right ones. But from the standpoint of making sure we're safe in the building, taking a test does not seem to be, from the medical professionals, the right thing to do. Now, if you're quarantining the whole group of basketball players and you're testing them on a regular basis, that's a different story. But we're going to be there for a day, so it's not going to really be helpful.
Thank you so much, and thank you for your service to all of us. Thank you.
Yep.
And Avi Shah has, I believe, a question as well. And thank you. It's so wonderful to have you with us as this tremendous resource.
Yep.
Yeah, thank you. Senator Roblin, I first want to start by just saying that I am sorry to hear about the tragedy that your family has suffered, and that they will be in my thoughts and prayers. Thank you for sharing that with us. From our business partners, a couple of questions have come about. First of all, we have pretty successfully, I believe, gotten out as much as we can anyway of the round 3 and round 4 business support funding through the state. We had some complications with the 2 competitive programs, and I think it was round 3 that suffered distribution because of that. But our partners at Willamette Workforce Partnership did a really good job of standing up that grant program. That said, we've heard rumors about a potential round 5, which I'm sure businesses, especially during this shutdown period, are concerned about coming into the winter months and early spring months of having that impact to their business. So the first question is, are you aware of any round 5 sort of funding or anything that we can be looking toward? The second question is that some of these partners have asked about impending free testing, COVID testing for employees. And, we've kind of seen these surges of free testing sites popping up, and whether there's anything like that on the horizon as well.
So first question, we are, the governor's office and the legislative office, with respect to all of this COVID money, the $1.6 billion that was out there, are going through every book right now to trying to find out what hasn't been spent, what has been spent. We made a few counties upset because we took some of their money away last time and put it into housing. And they said, well, we were planning on spending that money. So the issue is, we do anticipate that there will be some money out there. How much, we don't know. But I would anticipate that there's probably at least $100 million that's sitting out there. We sent a round to hospitals a while back, and a lot of that money has not been spent for smaller hospitals. So I think they're looking at every nook and cranny as to where there's money that has not been allocated or spent yet, because we know we have to have it spent by December 30th. So the goal is that we will find all of that money. We will sit down in e-board again and pull it all back and put it into a final round 5 in places where we think it can be used appropriately. And do I think that some of it will go to business? I do. I don't know how much, but I anticipate that we will find some resources there. And we're also making sure that everybody who is spending it appropriately, so we don't get clawed back from the federal government at some later date. So there's a lot of work going on behind the scenes right now with regard to that. The last 2 e-board meetings, we set money aside for testing. We're building a lab for a new kind of testing at University of Oregon. They had a little money left over, so they gave about $2 million of it back to give to OHSU, who is making 10 mobile labs to do testing. So do I assume there will be more testing available at low or no cost? The answer is yes. Right now, we know that we've gotten prices down to under $50 a test, which is way down from where it was to begin with. So yes, and Oregon State is doing some other stuff with respect to testing, and including got some extra money to continue to do their random testing around communities around the state. So depending on where you are, I think there will be opportunities for that. We also remade a commitment to nursing homes and other places where elderly are, to make sure that all of those people working in those facilities are getting tested a couple times a week, to make sure that they're not bringing it in from the outside, and trying to keep those facilities as clear of the disease as we possibly can. So in answer to those questions, yes. And again, I will tell you that my answers are basically from me. They are picked up from a lot of conversations that I have had the good opportunity to be in a lot of meetings with a lot of people. But again, I express my opinions about these more than I do knowing for sure any of this. I just believe I have enough basic information to give you the best possible answer that I can give you today. So,
which I appreciate. Thank you very much, Senator.
Yep.
And I wanted to follow up on Joya's question and your very able response, Senator, around the number of tests that are happening versus the number of tests that are coming back positive. And I've directed people regularly to the the OHA has a dashboard that's just the number of tests that are administered over the course of the pandemic's presence in Oregon. And since about mid-July, the number of tests per day, per week, and per month really hasn't fluctuated.
I know.
But so it's not really like we're testing more, so therefore we're finding more. But I often think about it as like a box, of a set size. And if we're testing the same number and we're seeing this number as the positives, if there is more in the community, that box is bigger, and therefore we have a bigger positivity rate or a higher rate.
Yeah. Yep. And the problem is we're testing where the most cases are happening, is where we're testing the most. So I mean. And that's why our county rates are oftentimes a lot lower, because when we get out there and we test those people, again, there's a lot more separation of people. There aren't as many cases per thousand, and I hope we can get it all under control. But thank you.
And then Mayor Cape has a question for you.
Yeah, thank you again, Senator. I appreciate your time. And maybe these are just comments or statements, observations, but I've already read some statements that have been posted on social media by some business owners that are saying we're not going to shut down. And so what exactly, I know the governor's, I guess, has asked law enforcement to help with some of that enforcement and fines and things of that nature. But there's a lot of business owners that just really feel hamstrung and not able to close. And if they do close, they're going to likely lose their business. And so I just, again, maybe that's just an observation or comment. I don't know if you want to speak to that. I'm concerned, and I feel for those people who put their heart and soul into a business and are facing such critical juncture of their business, and then at the same time, like you said, balancing out, well, we don't want more people to get sick, we don't want more people getting into hospitals, we don't want more people dying. So can you comment on that?
Yeah,
I have one other one too.
I guess what I would say to that one is Sophie's choices in the world are always hard, and it is very difficult, and especially if you've built a business up, family business, maybe over generations, it is really, really understandable. I feel the most for our our restaurants, who just basically got back in the building. They spent a lot of money getting themselves ready to do that, and all of a sudden they're going to have to eat out in the street again, and the weather's not conducive to that. So I do feel for every one of those businesses, and I think the governor doesn't take it lightly, nor does anybody else. At some point, if we don't get the virus under control, we won't have the businesses anyway. So I mean, there has to be a happy medium. I think she's trying to get that as much as we can. Not every business is closing, but you're right. If you are one of those that is, it's going to be really, really tough. And I think we have to expect that when we get moving forward, that there'll be another federal round of money to help people. I think there has to be. We're going to get out of people getting kicked out of their houses pretty soon, foreclosed. There's a whole bunch of other kinds of things that are going to affect this economy and all of these businesses if we don't figure out a way to get some more help from the federal government as well. So I think there's a whole lot of issues at stake, and I hope that our communities come together like they did before and come up with ways to help those businesses that aren't going to be able to work in this COVID environment. But we live in a world right now where there are these dichotomies. The political landscape is so divided that people do this just because that's what they think politically they're supposed to do. And that's a real frustration to me. As being one of those people who spent my career in the middle trying to get those people to talk to each other. When you don't get the same information and you don't even listen to the same information, it's really difficult to come to the same conclusion. And that's where we are in the world right now. And so I feel bad about that. I wish I could say that there's some other kind of thing. If they have a liquor license, OLCC is another one of those groups that's out there looking to see that people aren't, and you can lose your licenses. So they didn't stress that, and the governor did not talk about it. A lot of people asked her, what are you going to do? How are you going to get us? This isn't about catching everybody. That's not a purpose of it. We have seatbelt laws. We don't try to stop every car to find out if they're wearing their seatbelts. But we will catch them if they're doing something else wrong. It'll happen. So, I mean, I don't think anybody's going out to try to figure out which businesses are doing it or not. But if it's happening, I will tell you this. If it's happening and that person who gets COVID came to your place and they can prove or get even close that it was caused at your business because you disobeyed the rules, wait for your insurance to pay for that bill and see if your company is still existing afterwards. So I'm just going to say there are lots of things in society that take care of that kind of stuff. And it's not just because we're going to send police out to stop them.
Yeah. And the second point I was going to make too is I sometimes wonder how many actually will be able to close. I mean, I think obviously restaurants and whatnot, and I think a lot of restaurants have been able to shift and offer more grab and go or delivery services. And but like my daughter goes to a dance studio, and you know, and the owners reached out to me and said, hey, can you help us? We want to make sure we're following the rules, right? And she said a lot of other dance studio owners were not planning on closing because they fit under the youth activities group, and so they didn't have to close. And sure enough, Jody Christensen came back and said, yeah, that's right. They fall under the youth activities and they don't have to close. And so I see a lot of businesses trying to try and align themselves with a path so that they can stay open. And it's just another, I think, trying to find loopholes, I guess, try and find ways to benefit themselves in a way that they think that they need to. So, but
I have always been a person who believes everybody should try to find out exactly what the rules apply to them and which ones don't. So to me, that's not a loophole. That's finding out. If there's no evidence that having these dance studios has led to outbreaks, then I would think that, and some of the youth stuff makes that happen, I would agree. But so, I mean, try to find out. And the people at the state level are there, and they answer a lot of questions. That's what they're doing most of their lives right now, is answering those questions. So reach out and find out exactly what you can do and how you can go about doing it so that you are meeting the requirements and keeping people safe, because that's the whole purpose that everybody, I think, wants to live by.
Yeah. Thank you.
True thing. Thank you, Mayor. One question I wanted to ask, kind of as a follow-up to some of these, is you mentioned documented or evidence of transmission in certain industries. And I have a lot of, when we have county commissioner calls, the county commissioners say our public health officials aren't telling us any cases that are linked to restaurants or bars. And I'm curious if you have more insight onto the state level. I've heard one explanation, but I'm curious if you have one as well, specifically for closing that.
I think that restaurants in general have done reasonably well. The problem is that we've tried to keep bars not open as late, do other kinds of stuff to slow down the inhibitions that go away as you spend a lot of time in those places, and all of a sudden you forget about the rules of keeping your distance, not going patting the guy in the back when he makes a good joke, all of the kinds of things that happen. And we do know that it's small social gatherings that create the biggest problems lately. It really has been. You know, even the big fish plant one that took place in the North Coast was caused because of a gathering and a barbecue at 4th of July. And a whole bunch of people got sick and brought it back to the company. So it's trying to figure out how and what we do to cause less of that to happen. And I think that's why they have done that. I have not seen all of that data, and I know the health department's collected on everything. So it would probably be better if we were more transparent, though I will tell you that my restaurants that have been listed as an outbreak have not liked being that open. So even though they can show that their people got it from outside, the fact that they work at the restaurant created them on this list doesn't make people happy. So yes.
That's a good point, is that transparency also involves disclosure. And the way that Dr. Seidlinger, the state epidemiologist, kind of explained it to county commissioners on Friday, we got a later briefing than you did. It was after the announcement. He talked about how there's a significant overlap between the group of folks who are disregarding the social gatherings rules and guidance, and the people who attend in-person indoor dining in Oregon. That there's a lot of these that are in here, and that restricting the activities within the restaurants is a way to change and limit their interactions with people who aren't taking as many risks. And it was helpful to me to hear.
Yeah, that sounds reasonable too. Yep.
All right. Any other questions for Senator Roblin?
Sorry, I took up so much time.
You know, I think that we're all here so that we can communicate with our, community. So super helpful to me. And then with that, I'm going to go to Al Bannon from Representative Bonamici's office, Congresswoman Bonamici's office, to let us know all of the exciting things that are going to pass in the next few hours, I'm sure.
Yeah, unfortunately, I have no news to report in terms of COVID relief. The Congresswoman continues as her main priority to be a passage of an additional COVID relief bill. We don't have any information on a timeline on that. This group will be the first to know as soon as we know. But something un-COVID related that is great is we are expected to pass the National Apprenticeship Act, should pass this week, which I can send out more information on, but that will be really important for job training and economic development. So that'll be helpful and useful moving forward. And in terms of COVID relief, it just continues to be something that the Congresswoman knows is urgent. It is her number one priority, and she is urging her Republican colleagues in the Senate to pass a version of the HEROES Act that passed the House both in May and again in October.
I have two questions for you then, Al.
Yeah.
One would be, what are the odds of a skinny version of a stimulus package during the lame duck session? And then the other one, what are the 30-second version of the National Apprenticeship Act or Apprentice Act?
Yeah, great. I can't answer either of your questions because I just found out about the National Apprenticeship Act 3 minutes before I got on this call, and I said, great, I'll make the announcement, but I know that Commissioner Kula is going to ask me for details about it, and I don't have them, but I will send a follow-up email to you, Commissioner Kula, right after the call with some information and top lines about that bill. And then skinny version odds, I don't want to say anything that I don't know. I know that there's a lot of agreement that there needs to be passage of a bill. One of the things that the Congresswoman is and her Democratic colleagues is very adamant about, though, is that it needs to be funding that helps the people. And yes, passing a skinny version of a COVID relief bill is important, but what is more important is what is in that relief bill. So I don't know what the odds are. I know that depending on what's in there, I think Democrats would be willing to pass it, but it just depends on who's getting the bulk of the funds.
Okay, that sounds good. And as a reminder, but I remind you of this all the time, our public health funding for things like contact tracing is done at the end of the year.
Yeah, absolutely. And as you know, that was included in the updated HEROES Act and is something that the Congresswoman is continuing to advocate for.
Do we have, thank you. Do we have other questions for Al? All right, great, thank you. And I had the delight of watching this morning the Senate confirmation votes for Judy Shelton for the Fed board, but I didn't get to see how it ended. So somebody tell me in the chat. And with that, I would love to move on to our mayor who's on with us today. Mayor Kate, what would you like to share with people today?
Thank you. Not much of an update from the city. We're still planning to move ahead. We speaking to the senator's comments earlier, you know, we did ask and get clarification on what's the closure going to mean for our city hall and city offices, and we are closing. But the clarification was we could proceed with one-on-one appointment needs. So we're close to the public, so people can't just walk in and conduct business. They do need to call ahead and schedule an appointment. And so we're happy to be able to do that and to move forward. I think that's a good thing. So the other thing is we're looking at what do we do about our next council meeting, because that is on December 2nd, right? The last day of the freeze. And so looking at what do we want to do for that, possibly moving it back a day so that we could have that in-person time, because it's the last council meeting of the year. And we have a city councilor that's that did not run for re-election. And so, you know, we want to thank her for her time. And I guess they want to thank me for my time. I don't know. Anyhow, we're looking at some, and there's also a community member that's getting recognized as well. And so, you know, things that it would really help if you could have them there and be like, hey, here's your prize. Thank you for being so good. So, so we're discussing what are we going to do about that council meeting. So we are going ahead with our Christmas tree lighting ceremony. That's going to be on December 4th. We're working on an expanded parade route for our fire truck that has about 500 bazillion Christmas lights on it, and Santa will be riding on that, going around town, waving at hopefully, you know, the socially distanced families and family groups. We're working on putting together some like gift bags to give to the kids. The firefighters are going to be helping with that. So, and then they'll stop at City Hall and we'll wave, and then I'll turn on the lights to the tree and all that good stuff. So, if anybody's interested in having those type of ceremonies still and want to know what we're doing, you know, reach out to our City Hall and we would be more than happy to share those plans. And then, yeah, yay. I did want to share kind of an update from for what I'm doing at schools as well, Salem Kaiser Schools. So it is a crazy time. We were working so hard to get, we called it LIPI, limited in-person instruction, to get as many kids back into the schools as we could, following the governor's guidelines and the Oregon Department of Education and their Ready School Safe Learners guidance. So we were in full on trying to get, schools were bringing in groups of 20 kids at a time into the school. Usually one morning group of 20 kids and maybe an afternoon group of 20 kids. And that would be like Tuesday, Thursday, that group would come in, and then a different group would be Wednesday, Friday. And so you could be looking at maybe 40 or up to 60 kids at a school. Was kind of the max of what we were looking at. We were just really getting that implemented and getting the busing set up for those kids that needed transportation as well. And now, Marion County, we're in the pause, which ends today, and then we go into the freeze, which starts tomorrow. And so the district-wide, we've also put a pause on all of our LIPI, pretty much, and we're putting a pause on all the transportation associated with that, and just going back to the very limited LIPI and the students that just really need that direct one-on-one instruction, and we're looking at, you know, one student, not 20 students at a time coming into a school. And so really affecting us. It's making us have to be able to adjust and adapt daily. And we're still getting requests from schools that don't quite know how they're going to proceed through this freeze and trying to make those kind of adjustments. So it's just a very dynamic time for us, lots of changes. And we also have a lot of teachers, again, going back to, they were coming into buildings and now they're going back to not being in the buildings and working at home. My wife is one that she's transitioned from teaching at a school to she's now working in the Edge school that we have. It's the online school for Salem Kaiser's school. So full-time, no going back to the school building. She's just teaching in an online setting. And so that is growing. That's like 7,000 kids are enrolled in the EDGE program, which would be like the 20th largest school district in Oregon. And that's just for the one for our online education. So big things there. We're still working on passing out lunches at different bus locations across the district. We're approaching 250,000 meals being distributed this school year, which is a good thing to get to those kids. Before holidays, we're passing out multiple day meals. So like we just had Veterans Day, and so we passed out meals for Tuesday, the day before the holiday, and then also for Wednesday, the day of the holiday. And that's going to be also as we move forward into next week. I anticipate us doing that. And we're working really hard to also try and include a third meal. Right now, when they give out the meals, it's a lunch and a breakfast, and we're working really hard to also include a supper. And hopefully, maybe in December, we'll be able to get that rolling a little bit more. So just a real dynamic time here at Salem Kaiser, and things are changing all the time. I don't say anything set in stone. So here's the change for today. So unless there's any questions, I'll just leave it at that.
Well, Mayor, thank you so much for just like rolling with it, and for everybody at the Salem Kaiser School District really holding on to kids and helping them stay, connected. I really appreciate it. And it's good, a lot of teachers out there right now just have their heads down doing the stuff. And so it's really great to hear from you kind of on behalf of a lot of people.
Well, I try. I don't speak for the superintendent, but...
Duly noted. Yeah, that's a good reminder. I'm doing a question and answer session later this week with somebody from the Oregon Employment Department. And he said, let me check with my supervisor. Okay, great. Thank you very much. And I want to go to Council President Kelly Mankey. Welcome from the city of McMinnville. What would you like to tell people today or share with them?
Am I unmuted? Can you hear me? Okay, good. I just update you as fast as I can. There is going to be no work session tonight, and there'll be no month-end city council meeting on the 24th. So be aware of that for McMinnville. December 1st, 2nd, and 3rd, we are having our UGB public hearings where people can come and give testimony. Important to know about. December 8th is our final city council meeting, and December 18th, and maybe there's a meeting before, and this is the last one, is the UGB year-end decision making. Don't we have one with you maybe before that? I'm not certain.
We chose to do them separately, so I think it's like the next day after yours, then we do ours.
Oh, okay. So
we were being like independent.
Oh, I see. Okay, very interesting.
Yeah, but I'm excited.
You keep that excitement up. You and one other, please. January 12th, we will have our swearing in for most of the returning city councilors. We have one new councilor, and I'm sure we'll be Zooming all of the end-to-year-end meetings. So that's all I have for you.
Great. Thank you, Councilor Mankey. And we have with us, backed by popular demand, or at least I was like texting with her, is Councilor Elise Yarnell-Holloman from the city of Newburgh. And I asked Councilor Yarnell-Holloman to come and join us if she had time, because she works for Providence Health System, and I would love to hear kind of her perspective. She's she works for she is a counselor, but she also has this world of healthcare work right now. So welcome. And I could ask you questions, but I'd be happy to just turn the floor over to you.
Sure. Well, thanks for having me. And Elise Yarnell-Holloman, City of Newburgh, District 1. And I work at Providence Health and Services. I work for the medical group side, but since COVID, I have taken on a slightly different role. Raised my hand and kind of slightly regretting it. No, not really. I'm actually super honored to be able to be in the role that I'm in right now. So I stood up drive-through testing and throughout the state. So our drive-through testing sites are Tannisbourne, Bridgeport, Northeast Portland, Newburgh, Gresham, Seaside, Hood River, and Medford. So that's where we're currently doing our drive-through testing. And we've tried really hard to keep testing outside of the hospitals and clinics and primarily do it in an outdoor space. And it's been very successful. So I posted on Facebook last night, and I'm not a big Facebooker. I look at Facebook, but I'm not a big Facebook poster, I should say. And I posted on Facebook last night because I've had quite a few people just ask me my personal take on what's going on. And I would say I'm typically a more centrist, moderate when it comes to, and not an alarmist. And I will say that I've never worked this hard in my life. I'm on day 33 in a row and, truly working 12 to 14 hour days. So my team is doing all virtual triage, virtual visits, ordering of tests, resulting of tests for the entire state of Providence, inpatient and outpatient in our emergency department. So I see and result, or see all of our positives that come through the Oregon region. So, it's really disheartening to see local officials downplay COVID as I'm in the thick of it, and I'm observing and hearing the phone calls all day. We did 3,000 phone calls yesterday. And that's pretty much been the trend. During the surge in July, our highest call volume was 950, and we've been over 2,500 for the last 3 weeks. So, it's not a joke. And our positivity rate is ranging between 12 and 17%. In our mini surge in July, we were just around 7. So you can see that that's slightly very different. This last weekend, we had more hospital admissions than we have in all of COVID. So we were, us along with the other health systems in Portland, have started shifting bed capacity to be able to support COVID patients. And what that means, is shifting away from elective surgery beds, which elective surgery is not, elective doesn't mean to get my trigger finger fixed. It means cancers and heart and surgeries that are super important. So I feel like also we're in this conflict as a society of want testing and need testing. So want testing meaning I want to go travel, I want to go hang out with my friends for Thanksgiving, I want peace of mind for testing. And then there's need testing of truly sick patients, surgical patients, our healthcare workers, our first responders. And so until we have the testing capacity that is really needed in this country, we need to stick to need testing. So that's my public health soapbox for today. And my last plug is just to really, I think this is our time as a community to come together and love on healthcare workers and first responders and our educators that are really putting themselves in harm's way. We've had more healthcare worker positives in the last 3 weeks than most likely all of COVID. So we've had just a huge increase in positive healthcare workers, and it's a gut punch every time I review one. So.
Thank you, Elise. Counselor Yarnell-Holloman. I really appreciate your sharing that with us. when I read your Facebook post, I was like, everybody needs to have some healthcare worker in their life to tell them how important it is to listen to them. Are there questions for today? How about PPE? How is the hospital system doing?
Yeah, we need more. We've all had the same face shield since March. We do not have N95 masks. That's something that's of critical need right now. Our lab, so just so everyone is aware, when we say we need testing, like just breaking it down to layman's terms, like myself, we actually have a shortage of the tips to run the lab. Like that's the situation we're in. So yes, we don't have enough reagent. Yes, we need more swabs, but if we don't even have tips, there's nothing you can do. So, and then the other thing I'll say too is, there's a lot of rhetoric out there about reopening the state and the concern about Governor Brown's restrictions. And I will just say that we can absolutely have a semi-normal life if we do three things: wear a mask, maintain distance, and wash your hands. So for all the elected officials that want our county to open back up, those are the things you can do to ensure that our businesses get to thrive. So, I think it's actually pretty simple. And I really hope that our local officials can unite on this and together start masking and social distancing. And I think our businesses will be able to open back up.
What were those three things again?
Wear a mask, maintain 6 feet, wash your hands.
Sweet. I feel like there's there's a song called "This Is What Democracy Looks Like," and I feel like there should be one for COVID transmission reduction. But I'll work on it while other people speak. Thank you very much. And I have the economic development and commerce people, and so I'm just going to go with Abisha Stone. And thank you, Elise. Abisha, what would you like to share with people today, and how can you top Elise?
Impossible. I cannot top Elise. I want to thank her for sharing her information, and I want you to know, Commissioner Kula, that I really look forward to that song coming out. It's your one-hit wonder in the future. Just real quick updates I want to share with folks. I had already mentioned that our partner for the region, Willamette Workforce Partnership, who had been executing our state business grant program, did a phenomenal job of getting out as much of that money as we possibly could. And I want to thank across the board folks that are on the screen, Takesha, Scott, Joya, all of those who I'm not even aware of the work that you did in supporting getting the message out to our business partners that these grant programs were available, because I don't have final numbers, but I know that we were pretty successful in getting out the majority of the $2.2 million that were allocated for our region for disbursement. Also, the county grant program. So Yamhill County has a grant program, 5 different programs that they offered availability for our business partners and community partners. That program just closed on Friday the 13th for applications. We have formed a review committee. We are doing the work now of reviewing and scoring those applications, and we will be getting, or I should say the county will be getting those funds out to those award recipients before the end of the year. Looking for utilization of CARES Act reimbursement where we can. So we're running against that same timeline that the state is for getting those funds out. I also wanted to remind folks that because of the 2-week shutdown and potential impending future shutdowns, that OSHA is continuing to issue new rules. I think that Joya at the McMinnville Chamber has done a really great job of summarizing what those rules are and helping people identify where to locate them. So if you have any questions or concerns, speaking to the business partners who might be listening in the community at large, please reach out to me, to Takesha, to Scott, to Joya, to all of your kind of business facing partners. We are here to help you find that information and make sure that you're running your businesses with those rules in mind, and of course the safety for yourselves, your employees, and your customers. Lastly, because we're coming into the holiday season and we know that our business community is struggling with all of these regulations around COVID and providing safety for the community, I just want to urge everyone to shop locally. There are quite a few good websites where Build Oregon, for example, is an Oregon marketplace, so a maker marketplace. There are several others that exist and continue to pop up. And I just want to urge you that online shopping doesn't mean that we have to shop from outside of our region online. We can still shop locally online and support those businesses. So I urge you to do that. And that's it for me. Thank you.
Great, thank you very much. And I would say questions for Abhisha, but we should probably keep moving it. So Takesha, what would you like to share with people? And thank you for your patience.
Very similar to what Abhisha was talking about, shop local. I've been sharing on our chamber Facebook page via email also just the different ways they can support local shared businesses, restaurants that are doing takeout and whatnot. That's about it. You know, promoting our the different grants. Like Abhisha said, the Yamhill County one ended on Friday. I believe there might be one other one that's going on. I'll check into that. And then I just also want to mention quickly, Delphian that I work at, we also started doing more free online webinars for students. I'll just throw up the link here. We just figured it was a good time to try to start doing those a bit more again with our teachers. So that's available as well for if kids want, or even teachers. Some of the teachers, local teachers, have used these as just additional supplemental classes. That's it.
Awesome. Thank you, Takesha. Scott Cooper, what would you like to share with people today? Sorry, Joy, I'm leaving you for last, but it sounds like you're doing awesome work.
Just a quick messaging to echo Senator Roblin and Councilor Yamhill Holloman. Wear a mask. Stay vigilant. We can end this in the 2-week freeze. Let's do everything we can to make sure that happens. To do what we can to help our local businesses. Thanks.
Great. Thank you very much. Repetition is a way to get it into your brain. So, Joya, what would you like to share with people?
Okay, really quickly. I know all of you are dying to know what's happening with the bypass. So am I. I'm going to go and be on a meeting on Thursday. We have a monthly meeting, and so we're going to get an update on what's happening with the bypass because phase 3 needs to finish. So let's pray that gets done because we love our bypass. And I think I'm saying this publicly, it should be named the Hageberg Highway. Don't you think that's an awesome idea? I love that idea. Anyway, I like the alliteration as well. By the way, our unemployment rate dropped to 6.9% in Oregon from 7.9. That was very exciting news. And that was last month. So who knows what it'll look like next month, but be that as it may. MDA, you know, we talk a lot about shop local. MDA is doing the 12 weeks of Christmas. Go out and spend money in a business on 3rd Street and get entered to win a $500 gift certificate. If you buy something over Thanksgiving weekend, it's $1,000 that you could be, I know, right? So anyway, it's not even about getting, free money and a gift certificate and everything else. Go out there and support your local businesses because that could be the difference between that person being able to send their kid to dance classes or buying a cup of coffee or whatever it is. Our businesses are the heartbeat of our community, and let's support them all as best we can over the next 2 weeks. And thank you. That's all I have to share. Thank you very much.
Awesome. Thank you so much, Joya. And we have made it just 5 minutes over our 1 o'clock or our 1 hour mark. But I did want to note that there is a little bit of hope because Senator Roblin, mentioned this kind of the looking at metrics for how we get out of the pause. And at 5:30 tonight, the Yamhill County Commissioners are meeting with the governor to talk about that. So I just saw it come in on my desktop here. Wish everybody luck in figuring out what the best way is to go forward. All right, remember, what are those 3 things? It's wear a mask. What's the other thing? Keep your distance. Yes, and then the 3rd one? Wash your hands. All right, great. Thank you, everybody. And remember out there, these people are working for you every day. So we will see you next week and stay safe.